a lot of the issues our people, deal with. It was, my father had cancer, my brother was killed, juggling little people that had, mental health issues and like the seizures and the health stuff that comes with that. So yeah, when I came back, I reached out to Family Connect and Support again, and they've been my lifeline, honestly. I tried to access a lot of mainstream services, and I found that every time I did, I was walking away quite drained, and I'd have to retell the whole story, and it was re-traumatizing, and then I'd feel drained and ashamed and all that sort of, emotional roller coaster. Family Connect and Support, I don't have to do that because Kellyanne's got my back. She writes the support letters and notifies these people. She does the phone calls and the keeping them guys up to date so that mentally I don't have to prepare myself to go in and have them conversations. I don't have to, be drained at the end of the day. I can come home to my kids happy and just be a normal family.
Yes, my name's Craig Ardler. I'm the CEO of the South Coast Medical Service, Aboriginal Corporation, Nowra. Been the CEO for around 24 years. So South Coast Medical Service basically started around 1992. Started with little to no funding. I think we originally got $40,000 in funding from New South Wales Health. Got a little bit of support through the Redfern Aboriginal Medical Service in Sydney. Started from very humble beginnings, out of rented premises. Originally started out of the Aboriginal Culture Centre in Nowra, which no longer exists. The organisation was set up primarily because of the lack of cultural understanding GPs had for our people. Didn't understand what the issues were. They just treated them for whatever they thought they needed to be treated for rather than doing proper investigations and their family histories and that sort of thing. So we needed to have a service that tuned to the need for our people. So my grandmother, along with a number of other elders along the coast, got together. A lot of the staff that were working there, some of them mostly worked voluntary for a number of years. We provided support and advocacy for clients. We did have doctors at times, and then we didn't have doctors. So there was no real consistency. There was no real consistency of funding. There was no, I suppose, consistency of support from the government either for this area. With what some resources and support they did have, they assisted right along the coast all the way down to the Victorian border. So some people just drive the vehicle around that they had to take people to doctors, hospital, specialists in Sydney. I did that myself. I've done a lot voluntary, basically supporting grandmother. The whole family was involved in helping support the organisation from its inception. So.
Just the aunties and uncles mentioned I was going through a bit of a tight spot and I needed some support, so that's how I found out about the AMS, and we went from there, and they've been great. They've helped me through when times are tough and with a lot of stuff. We just touched base with one of the workers and we went from there, and we've had a lot of support since then, a hell of a lot of support. They've always helped us, whether it be, like at the moment they help my son, he's had a bike accident, so they support him going to Wollongong Hospital and all his doctor's appointments, and it's just, it's a good area because of the purpose of, they take a lot of weight off a lot of people that's got families and children and can't do that sort of support themselves. Like I don't have my licence at the moment, so without them, we'd be buggered.
So we do the tuning into kids, tuning into teens, and we've just started dads tuning into kids, which is really popular. I've had 6 participants who eagerly turn up every week. They're loving it. Really helps parents come together and realise we all experience these difficulties and common challenges, and giving parents a voice and giving them strategies about boundaries and basic child development, brain development in our teens, and how they're wired to push and take risks, and kind of gives parents that, oh, okay, so this is normal, or you get that too. So yeah. brings the community together that way too.
So the Targeted Early Intervention Program is an Aboriginal case management program where we support families for up to 6 months. All begins with the family being referred to us through basically any avenue, including self-referrals, education, Department of Community and Justice, etc. First thing we do is, as a team, we'll all sit down and have a look at the referral so that we ensure that the family first fits our criteria and that we can allocate to the most appropriate caseworker, especially if it's like, say, for families specifically needing support around housing. We have caseworkers that have more knowledge around housing, other caseworkers more knowledge around NDIS, so we'd allocate to those. Once we have allocated the family, we do a needs assessment with the family, which is quite intensive, and it looks at all aspects of the family's lives, from housing, drug and alcohol, to domestic violence and financials. From that will influence the case plan that we do alongside the family. The family are expected to walk alongside us, not us kind of just lead the way. It's part of a journey together. From there, we will support the family in any way they need, whether that be referrals to internal and external services. It might be advocacy, going to meetings with the schools or housing, providing transport, connecting with mental health and general health supports. Whatever they need, we will help them out to build up their family's capacity to the point, we want them to get to a point where they no longer need us.
Across the sector, there's obviously a massive amount of funding that gets put into out-of-home care. Coming from out-of-home care for the last 13 years, there's a significant amount put in the back end of the system and not enough at the front end. I sit on a panel called the Safeguarding and Decision-Making Panel for Aboriginal Children. So it's a panel that runs every month and looks at families with Aboriginal children where there's potential that they may come into care. That's rostered. I'm rostered on to do that monthly. However, we're getting calls to sit on panels every week, which is a clear indication Aboriginal children are still coming into the system at a significantly high rate. And the fact that they're not willing to put money at the front end, they're actually taking some away by reducing preservation funding as well. That's a massive challenge, and you will see this. You will see the impact of that if it continues down that path. Yeah, we'll have more families that need that support that can't get that support, and we'll have more kids just continuing to come into care. And unfortunately, we'll continue to be doing this job forever and a day. So.
We sort of advocated with Youth Justice to have our contract changed so we could accept community referrals. Yeah, so that's where kind of that early intervention work is happening now in the youth justice space. So we can accept referrals from anyone in community, and we have had some young people in our out-of-home care program that we've supported in the youth justice space in that early intervention before they were actually having official or formal involvement with the justice system. So,
you know, the price of food and groceries and rent, everything's gone up. And, but, you know, it's not just the Aboriginal mob that's got to dig out of one bucket. It's all the other people in the community that's digging out that one bucket as well, for support for services and food and whatever, and, you know, electricity and rent and all that sort of stuff. You'd think it'd make sense if they'd fix the front end before they fix the back end. Then you'll have less kids in care.
I know our program is very much doing those referrals, advocacy and that sort of stuff, but it's really about that connection and connecting to community and knowing where to go, who to go to. And being, as a caseworker, just being that person by them, being real, and hearing them, I think is so important. Yes, we are caseworkers, but at the end of the day, we all live in our community, and, you know, we all will need that support one time, and just being that person that's genuine, that's real, and can walk that journey and hear that person where they are and what they're needing, not what we're all thinking that family needs. It's a big part of what we do, I think, just being that bridge.
Well, if this didn't exist, there's a lot of the elders wouldn't go anywhere, and that's like they're not going to go and sit at hospitals, and there's no services like this service that cater for the elderly, and they're pretty thorough. Like the doctors are thorough, where they'll ask you, have you been to the dentist? How long is it since you've been to the dentist? And things like that. Where another doctor's a doctor, and that's it. These guys are there for your well-being, and and they practice what they preach. So it's a big thing. There's not another doctor's service that'll benefit for you the way this one will. I've been all over Australia and a lot of places, like I said, you'll wait 2 weeks to get your kids in, and if you're in need, they've got walk-in clinics where you come in, you just wait, and that they address everything that needs addressing, and it keeps you to be so thorough too with your children, like make sure you don't miss out on things and they don't miss out on what they need and stuff like that.
So I'm out in the community at community events, seeing sister girls going through some of the traumas that we went through, and I'll tell them. I was like, this is the organisation. Ring them, get on the waiting list. They will allocate you a work to support you. And there's been times where I've just said, look, this is Sister Girl's mobile number, give her a ring, have a yarn, you know. It makes you feel good knowing that you're helping another family access the services that they need, yeah. And you're not just, you know, they're actually going to get help when they get there. It's not just going to be another appointment. Care and kindness and everything, yeah.